tracing in Chicago. And we have Dr. Emily Stiehl, who is an assistant professor of health policy and administration. She received her PhD in organizational behavior and human resources from the University of Pittsburgh, and she is also the co-PI of the CDPH grant for contact tracing in Chicago. She'll be speaking to us shortly. I'm not sure if we have Dr. Hebert-Beirne here as well.
She's also on.
Oh, okay,
Yeah,
great.
like she just joined you. I'm here, Io. Can you hear me?
Oh, yes, I can.
Okay.
So she'll also be speaking to us, and she's also working strongly on this grant from CDPH on contact tracing through community engagement and other aspects of it. So I'd like to welcome Emily for our session.
Thank you so much. Thanks for the nice introduction, Io. And as Io mentioned, Jenny and I have been our sort of co-directors of this SHI tracing initiative through UIC, and I'll talk a little bit more about what that means. But as Io mentioned, I hope that as we go through, if you have any questions, feel free to type it in the chat box. I'll try to keep an eye out as I'm speaking, but then, we'll definitely come back to anything that I miss at the end. I'm going to go through sort of an overview of this SHI tracing initiative, which is the Chicago Department of Public Health's contact tracing initiative. I'll tell you a little bit of the details about what this program is and what some of the unique characteristics and unique objectives of this program are. And then, hopefully, since we didn't get to hear about the contact tracing that you heard about last week, I'd love to hear your thoughts about how the programs are similar, how they're different, and and even kind of what you're hearing from this class about COVID-19 contact tracing and some of these new initiatives. So just to get started, some background, as I'm sure you're all aware, in the city of Chicago especially, we're seeing that the impact of COVID-19 is uneven. For the rate of infection has been 2.2 times higher among Black Chicagoans, 3.5 times higher among Latinx Chicagoans than among white Chicagoans, and the mortality rates in both of those groups are also higher. So it's, I think there are billboards around the city of Chicago that say that, COVID-19 doesn't see color, it doesn't see boundaries, it doesn't see age, it can affect anyone. And so COVID-19 has really shined a spotlight on the longstanding racial inequities in health and economic outcomes across Chicago communities. So this Chicago community-based contact tracing core, the SHI tracing initiative, was really designed to try to undo some of the inequities that have existed in the past, and also to try to address some of the adverse effects of COVID-19 in certain neighborhoods as opposed to others. And so one of the things that the city of Chicago did is they awarded the Chicago Cook Workforce Partnership a 2-year, $56 million grant to coordinate and conduct the city's contact tracing efforts. Now, I just want to clarify, the city of Chicago has already been engaged in contact tracing. They have a small group, I think of 31 contact tracers who have been doing the contact tracing for the city. But given the large numbers of Chicagoans who are becoming infected and who are also, in contact with others who might be potentially exposed to infection, they decided that the best thing for them to do was to expand the reach of their contact tracing initiative. So the Chicago Cook Workforce Partnership recruited partners from UIC, that's the initiative that Jenny and I are co-directing, but also from the University of Chicago, the National Opinion Research Center, which you may have heard of as NORC or NORC, Sinai Urban Health Institute, which is affiliated with Mount Sinai Hospital, and it's their sort of community outreach arm, and then Malcolm X College, which is one of the city colleges in Chicago. The goal of this program was to have 85% of the funds that were awarded be granted to at least 30 community-based organizations who would be the actual entities hiring on contact tracers. So the goal was to fund community-based organizations that are in communities that have historically faced barriers to employment, and then have those community-based organizations also hire on individuals who may have historically been faced issues when finding employment. So returning citizens, individuals who may have faced discrimination or anything like that. So they were really trying to understand how to build an infrastructure that would give economic resources to neighborhoods that have been hardest hit, and also just resources to try to address this pandemic in neighborhoods that have been hardest hit. So the idea here is, again, that we're trying to identify and fund organizations in disadvantaged neighborhoods, really neighborhoods that have historically had a harder time with economic opportunity, or whose citizens have had a harder time finding employment, to hire the city's community-based contact tracing corps. They're really trying to create roughly 600 career opportunities for Black, Latinx, and other Chicagoans disproportionately impacted by COVID-19, and to establish and operate a Chicago COVID-19 Resource Coordination Hub. And this Resource Coordination Hub would, the goal of that, which we'll talk about in a second, is to identify resources in communities that could be used to help people who need wraparound services. So for instance, if someone identifies that they have tested positive for COVID-19, but they live in a multifamily household, or they share a lot of space with others, how could they, how can the city provide resources to them so that they could isolate effectively, not infect the other members of the family, and still have resources to do the things that they need to do. So this is kind of the project overview. And so I wanted to talk a little bit about the different partners who are involved here. So the Chicago Department of Public Health is kind of the key entity that started all of this. They're the representative from the city of Chicago, and they're really funding this initiative. And they funded it through their they funded the Chicago Cook Workforce Partnership to lead this effort. And the Chicago Cook Workforce Partnership recruited UIC, Sinai Urban Health Institute, Malcolm X College, and NORC to be partners in this initiative. So I just wanted to quickly go through each of the partners and kind of what the goal is. From the Chicago Department of Public Health, one of the really nice things about working with them is that they have this vision for this contact tracing initiative that goes beyond contact tracing. So, while their program goal is really to suppress secondary transmission of COVID-19 by working with these community-based organizations to establish this contact tracing corps, their longer-term goals are really to build an infrastructure for public health in the city of Chicago, leveraging the relationships that they'll build with all of these community-based organizations, and also leveraging a career path initiative for the contact tracers who are brought in. They want to develop robust partnerships with the CBOs to uplift communities in under-resourced neighborhoods, and they're also doing an initiative by developing partnerships with hospitals and FQHCs to cultivate a broader healthcare workforce. So in addition to doing contact tracers with these 31 community-based organizations, they're also trying to leverage healthcare hospitals and federally qualified health centers to also continue doing contact tracing in their facilities, testing and contact tracing there as well. So the city of Chicago is really looking at this contact tracing initiative not just to suppress secondary transmission of COVID-19, but to build this longer-term public health infrastructure, which I think what attracted Jenny and me to this project. So going through the partners, each of the partners brings a different skill set, and so we're really excited to be working with all these different groups because they're focused on different aspects of the overarching project, but they're really bringing a unique set of tools to the project. So one of the things with the contact tracing corps, as you know from this class and from the things you've been learning, usually if someone tests positive, they go into a system in the state of Illinois, the INET system, and then they get routed to a Salesforce database. And the person who tests positive is sent to a case investigator. That case investigator will talk to the person, ask them what they've been doing in the last few days, where they work, where they live, and then if they've been in contact with anyone for extended periods of time to the point where that person could have potentially become infected with COVID-19. Once those individuals are identified, those individuals get sent to the contact tracers. So within each of these 31 community-based organizations, we have approximately 15 contact tracers. Those 15 contact tracers have a supervisor who's been hired as part of this initiative. And all of those employees are actually new employees to this community-based organization. So one of the things that we're trying to do is we're really, the partners who are involved are looking at the community-based organizations, the supervisors, and the contact tracers. We're providing training, we're providing education, but we're also providing professional development, and we're providing a space to try to learn new skills, a space to also vent if needed, or brainstorm on new ways of doing contact tracing. We recognize that in other cities, one of the key reasons for failure is that individuals who are contact tracing, they're confronted with some really difficult phone calls. They're contacting people who may not even know that they were exposed to COVID-19, and they're trying to tell individuals, here's what happened, here's what you should do next, here are the resources you need. So as part of this initiative, those are a lot of things that need to be accomplished, and so we've tried to break it down within each of our partner organizations. The first organization I wanted to tell you about is the Sinai Urban Health Institute. Sinai Urban Health does a lot of work around training and skill building for community health workers, and so we've been leveraging their experience in that domain to try to carry over an understanding of some of the so-called softer skills that will really enhance the effectiveness of the contact tracers and bring that into this new domain. So Sinai Urban Health Institute, their role is really to provide consultation to the community-based organizations as needed, but then to deliver supplemental, what they call booster trainings, to all of the contact tracers who go through the contact tracing training, but also to supervisors on how to supervise, how to manage, how to lead these contact tracers effectively. They're also doing some booster training around soft skills. So they're looking at things like cultural humility, motivational interviewing. They're trying to give the contact tracers skills so that while they're on a phone call with someone, they can instantly build trust with the person on the other end of the line and really help to initiate a relationship that's going to make this COVID-19 process as effective as possible. They have also taken the lead on developing 2 learning collaboratives to support the work of the contact tracers and the supervisors. So as I mentioned, they're going to have either bi-weekly or maybe monthly sessions where the contact tracers can come together and actually discuss as a group sort of what are the challenges that they've been encountering, what are the successes that they've identified, what are some best practices that they can share so that they have an opportunity to feel like they're not so alone. Especially with COVID-19 where everyone's working remotely and in isolation, they're really trying to give a space so that people can share their experiences and benefit to the largest degree, find new ways of doing this job and expanding the work that they do. So Sinai Urban Health Institute, again, is really helping to develop this training and skill development around softer skills, and also helping to guide these learning collaboratives around best practices and challenges to give supervisors and contact tracers space to explore what it is that they're doing and to try to find better ways of doing it. Our next partner is Malcolm X College. And Malcolm X College is one of the 7 city colleges of Chicago. It really has, it's designated Center of Excellence in Healthcare. And so they developed a curriculum similar to the Johns Hopkins curriculum, if you've seen that, around what is COVID-19, what are some of the factors that we need to consider, what's the medical side of things, but then also what are some of the softer skills that you need in order to do contact tracing effectively? What are some of the considerations that you might have? So Malcolm X College is delivering all of the training for the contact tracers initially, and so it's actually been really impressive. We have our 31 community-based organizations who have been brought on board, which I'll talk about in a second. And some of those community-based organizations have already been hiring contact tracers, and some of those contact tracers have already made it through this Malcolm X College system. If you think about, hiring 600 contact tracers in, a month to 2 months is sort of a very large endeavor, and getting them all enrolled in, a Malcolm X College curriculum and things like that, it's a lot of work on the back end. So it's been really impressive to see Malcolm X be able to get this program up and running so quickly, and they've been enrolling people as they've been hired through this process. The next partner that we have is NORC, and they're really in charge of the Resource Coordination Hub, which is a piece that's really ongoing. what they're trying to do is to provide a service to the contact tracers so that if a contact tracer is talking to someone who needs wraparound services, maybe they have food insecurity or housing insecurity, or maybe there are other things that they need, maybe mental health resources or babysitters, even daycare for their children. If they need these services, the Resource Hub is designed to help identify community-based resources that individuals could use and to translate that to the contact tracers, or at least to interface with the contact tracers so that the contact tracers know, hey, this person needs these services, let me refer them to a resource coordinator who can help them identify which resources they need and then set up referrals to those resources. NORC, one of the neat things that they've been doing is they've been working with a system called NowPow, and I'm not sure if anyone's familiar with that, but it's a system that identifies community-based resources, and if the community-based resource has a certain level of subscription to the service, the organization that's using NowPow can actually reach out and see, they can refer clients to these different community-based resources, and then they can actually see whether the client took advantage of that referral. So they can actually check back in and see which of these services did the person take advantage of, which of these services did they maybe not use, and that's a way of at least tracking, the effectiveness of some of these things, so that in the future when they make recommendations, they can find out, which recommendations might be most useful and which ones might not be as needed. So they are providing technical assistance for establishing and operating the Resource Coordination Hub. They've also done a lot of work on the back end to connect this NowPow system to Salesforce. So they're really trying to make sure that the system that the contact tracers are using can interface well with the system that the resource coordinators will use to connect clients to community-based resources. And I think finally, UIC School of Public Health, we're the last of these great partner organizations that I'll talk about, but certainly not the least. We are helping primarily with the community-based organizations with onboarding and ongoing training. And Jenny's going to talk a lot about that in just a few seconds, but the contact tracing, so really what our role has been so far is to help with the review of community-based organizations, help with the onboarding of the first 10 organizations, and then the second 21 organizations. We help to coordinate guest speakers to those onboarding sessions, including some of the experts that you may have met through this class or you may meet in the future, who are experts in our School of Public Health. So we had Mark Dworkin come and present on what is contact tracing, so that the community-based organizations, some of whom do not do as much public health work or do not sort of identify as an organization that does public health work, that they could kind of understand the public health foundation of contact tracing and what their role could be as joining this public health infrastructure. We also had Dr. Ron Hershow come and talk about epidemiology and biostatistics and some of the metrics and measures that we use to understand COVID-19, understand positivity rates and mortality rates, what those measures mean, and what some of the history of those measures have been since March or April when it really started to flare up. We are also helping with an earn and learn portion of this project. One of the, as I mentioned, the city of Chicago, the Chicago Department of Public Health sees the long-term vision of this program as not only being to suppress the secondary transmission of COVID-19, but to develop a new infrastructure, a new public health infrastructure in the city of Chicago that can help previously underserved communities to have more resources and to have more investment in the infrastructure that exists in their communities. So the earn and learn piece is that we understand that this contact tracing initiative is only going to last up to 2 years. And so one of the key pieces that's really important is that after the funding disappears for contact tracing, the city and the partnership and all of the partners really want to make sure that the contact tracers have sort of something else that they can move into, that this is the first step in a career in public health or in healthcare. So the contact tracing positions, the contact tracing jobs, are not just, a part-time job that then ends and then there's nothing after that, but they're supposed to be sort of a step to a career in these fields. And so one of the pieces of the Earn and Learn that we're trying to work on, IO has taken a huge role in doing this, is understanding, what are the needs, what are the potential careers that could come after someone has been successful with contact tracing, and then what are the educational or training or developmental requirements that those jobs would have. There are some jobs that might need just certifications in order to move into that career. Other jobs might need anything from an undergraduate degree or a master in public health. And so we're trying to help the contact tracers to think about what kinds of careers might they be interested in the future, and then to connect them with resources so that they could pursue development and professional development, skill development, and hopefully move into those careers in the future. And the last thing that we have been doing, we're really focused on evaluation. With a lot of the contact tracing initiatives across the country, there's been such a push and such a rush to get these contact tracing initiatives up and running that there hasn't been much focus on how will we know if it's working? How will we review it in the background? So we've been trying to figure out, as each of these sections comes up and gets running, what are some ways that we could start collecting data now so that we can think about what that means in the future. So again, just an overview of the contact tracing core. The city of Chicago is hoping to hire 450 contact tracers and 30 supervisors, but again, they're not being hired by the city of Chicago, they're being hired by these 31 community-based organizations. The community-based organizations were competitively procured. They had to submit applications. They were reviewed by a number of individuals from the five partners, and then they were ranked and they were selected that way. There's also the Earn and Learn training program in healthcare occupations or public health occupations for permanent employment upon the completion of the training core. And so just to kind of reiterate, the CBOs, the community-based organizations that were selected, had to be located in or primarily serve residents in high economic hardship communities. They and then as they're hiring on their contact tracers, the desire is for them to recruit residents of high economic hardship community areas, residents returning from incarceration and or who have had historic involvement in the justice system, and residents with demonstrated barriers to employment, including but not limited to disability, housing, food, or healthcare insecurity. This is just a map of the city of Chicago with some of those target communities highlighted. And this is where the city was really hoping that the community-based organizations would be sort of serving these different communities. This is just a quick list, and I apologize that it didn't transfer quite as well. I think that's Blackboard. But this is the list of the 31 community-based organizations that are partnering with the city of Chicago and the Chicago Cook Workforce Partnership on this new initiative. So these organizations have already started hiring on their contact tracers, and they've started really trying to build this infrastructure where they're getting their contact tracers trained on what contact tracing is. There's also going to be a training on how to use the Salesforce system that all of the contact tracers will be using to get access to the contactees and to do the phone calls and to read the scripts and to collect information so that we can try to stop the secondary spread of COVID-19. The Resource Hub overview, just to give another quick sort of recap of all these different activities. The Resource Hub is going to refer diagnosed individuals and those with sustained contact, so those who were potentially exposed to COVID-19, to testing, treatment, social services, other resources. It could even be something where, if someone is experiencing domestic violence and that comes out during a phone call about COVID-19, that the Resource Hub might be able to connect them with resources to address that. So the Resource Hub is really trying to connect people to resources that are going to be helpful. The goal is to have it staffed by 90 resource coordinators and 10 supervising coordinators, And these employees are similar to the contact tracers. They're going to be hired on. They're also going to go through this earn and learn pathway, but they're going to be hired by NORC, so the University of Chicago. So unlike the contact tracers who are hired by the community-based organizations, the resource coordinators are going to be hired in to NORC to serve in the role, so that it's all centralized. As the contact tracers need help, they can just go to one place. And again, this is just, sort of the history of contact tracing, which I think you've seen before. But there's a positive COVID-19 test that comes in. It goes to the case investigator. There's contact notification. If needed, individuals get sent to the resource coordination hub, and then there's eventually surveillance and monitoring, and that happens, I think, automatically through the Salesforce system. Individuals who have tested positive or who have been exposed to someone who tested positive receive text messages that I think twice a day asking, have you been isolated today? Have you really made sure to stay home? Have you had contact with anyone? Just to keep track, just to make sure that there's no additional threat of spread of COVID-19 after that. So again, if you look at there's the federally qualified health center piece, offering testing for the uninsured. There's a hospital and other healthcare provider piece. And these pieces, the city Department of Public Health already has, I guess, 50 case investigators, 70 contact tracers, 25 are staying until the end of September. There's the federally qualified health centers, hospitals, and then the community-based organizations are the piece that UIC is helping to build. And the target, again, is that by the end of September, they'll have 480 contact tracers and 100 resource coordinators. And I think beyond that, they're hoping to get all the way up to 600 contact tracers. I think the final piece of what I'll say, and then I'll hand it over to Jenny for the really exciting piece, is that they're looking for professional, the last piece that kind of connects this puzzle is professional development and earn and learn. So again, as the core members come on board, they're going to be engaged in training at first from Malcolm X College, training and booster sessions through Sinai Urban Health Institute, and then also this ongoing learning collaboratives through Sinai Urban Health Institute. But part of that learning collaboratory and part of that ongoing work is going to be to introduce them to different professions, to do skills surveys of what types of careers they might be interested in, and then professional development, which will actually happen during their 40-hour work week, so that they don't have to come in extra. It's nothing above and beyond what their work would require. It's part of the workday. They'll receive professional development so that they can start thinking about what would they like to do in the future, what career would they like to pursue, and the partnership is going to help them to get resources to do that. So that's very exciting. Sorry, one more slide, and then I promise we'll hand it over to Jenny, and then she can present the communities of practice, which are really exciting. The last slide is just this evaluation overview, and UIC is trying to develop an evaluation plan to assess the outcomes of this initiative and to develop best practices. And some of the questions we're trying to ask are just, at a high level, what's happening to the COVID-19 statistics as this core comes on board? So as we start the site tracing initiative, what's actually happening to the numbers in the city of Chicago? Are we seeing rates decreasing? Are we seeing rates stay the same? Are we actually successful at suppressing the secondary infection? The other thing that we might try to find out is how the trainings for the contact tracers are actually influencing their knowledge and attitudes and behaviors. So we're looking at the trainings both from the knowledge about contact tracing, about COVID-19, how it spreads, but also some of the softer skills that Sinai is going to be bringing in. Does the training actually improve things like cultural humility, motivational interviewing? How are the contact tracers improving these interpersonal skills through phone-based media? We're trying to look at how effective this contact tracing initiative is for the career opportunities for contact tracers, whether this initiative contributes to healthy work and health equity for the CBOs, and also how it builds a network among the CBOs. So at the end of this project, are we really helping the city of Chicago to reach this long-term goal of having a well-connected, developed public health infrastructure that didn't really exist before. And this is just a very big sort of initial overview of some of the evaluation pieces we're thinking of. We have, initially we want to understand for the contact tracing, were the the individuals who were exposed to someone who tested positive for COVID-19, what were their behaviors in terms of quarantine, testing, medical care? Did they actually use the services that they were referred to? We can get some of that possibly through NowPow, but some of it we might not be able to observe directly. So instead, we also want to look at the contact tracers. They received training and support. Did that help them to pursue public health careers? Did that help to improve their contact tracing effectiveness and quality? And did those things that end up improving the statistics around COVID-19? From the community-based organizations, they also receive the CBO training and communities of practice. We want to know, does that help to improve healthy work for their employees and also for the contact tracers while they're there? Does it also help to improve capacity? Having this new set of employees who may not have the demand to do contact tracing for the 40 hours a week that they're employed, can the community-based organization leverage this opportunity to build new capacity with networking with other CBOs, networking with the partners, to develop and sustain their own activities in the long term? And then for the community, does this contact tracing initiative help to build trust, help to build health equity, help to build capacity in those communities as well? And at the end of the day, we're really interested in improvements in COVID-19, but like I said, longer term, how do these things impact the city's ability to improve health equity across neighborhoods and groups? And that's a great question. I just saw Megan mentioned, do contact tracers only reach out to secondary contacts? Yes, that is the case. Case investigators reach out to individuals who tested positive. Contact tracers reach out to the secondary contact. If a secondary contact tests positive, they actually get routed back into the system and get sent to a case investigator to go through that route. So with the contact tracers, if someone feels like they have symptoms, the contact tracer could direct them to testing services or could direct them to other resources that they could use in the meantime. They could, give them the advice that you should probably isolate and, keep to yourself for a few days until you know for sure whether or not this is COVID-19 or if your symptoms get worse. But yeah, so the case investigator then would take over if the person goes to get tested and they receive a positive result. So what I will do now is, I've talked for a long time, so I'd like to hand it over to Dr. Jenny Hebert-Beirne, who has been really working on this community-based organization, communities of practice. And so as I mentioned, there are so many different levels. UIC has really taken the lead with the communities of practice to try to figure out how can we help our community-based organizations build capacity and provide a healthy workplace for these new contact tracers that are coming in. So I'll hand it over to you, Jenny.
Thanks, Emily. Can you hear me okay?
Yep, sounds great.
Okay, all right. Thank you. And I want to start first by saying how much I love co-running this project with Emily, because she has such a clear vision of all these really complicated pieces. And every time I hear her describe this, pieces are more clear to me all the time. So first of all, I'm super impressed with this list of attendees in this class, and I recognize 2 of this long list of names. And so I am going to just take a second to introduce myself. It's really exciting to have so many people outside of the School of Public Health, it seems like. So I am an associate professor in the Division of Community Health Sciences, and I'm a community-based participatory researcher. And that's someone who does research in partnership, mostly with community-based organizations, sometimes agencies, institutes, sometimes residents of neighborhoods or patients, so individuals. And there's a reason why I'm introducing this. People who do community-based participatory research want to work in partnership with people who experience the phenomena of interest that you're researching firsthand. And the idea is that in this kind of collaboratory research approach, you're really grounding the research in the lived experience. You're kind of closer to the phenomena. We think you produce better data, better findings, and are able to really intervene on the phenomena better. And with my interest in being a participatory researcher, I'm the interim director of something called the Collaboratory for Health Justice. And this is a space in our school public health that's really devoted to helping our faculty, students, and staff in the school public health do engagement better. So engagement in terms of research, so like participatory research, doing engaged teaching, doing engaged practice. And I say all of that to say that I'm delighted to be able to tell this part of our story, because Emily's right, it's super exciting to us. And I want to give a lot of credit to your instructor, Dr. Linda Forrest, because she saw this as an opportunity for our school public health and for the Collaboratory for Health Justice to take part in this citywide unprecedented initiative. And the reason is at least twofold. It provided us as an academic institution a opportunity to really, flex our muscles in this space. It really come to answer the question of what is the responsibility of an academic institution at the time of a crisis, and how can we use our science, our expertise to be responsive. Yes, so many people had a role, but Linda really pulled off this, getting us at the table for this funding opportunity, and actually also thinking about what would a really strong team look like to put forward for this opportunity. So Emily did a great job talking about all these different partners and the different strengths that we bring forward. And I want to start with just reflecting a little bit on what this crisis means for public health. And I'm going to quote two different institutions that just have caught my eye lately. One is the William T. Grant Foundation, and they're a funding entity that has a funding mechanism called an institutional change grant. And we actually just applied for a big grant from them. But a month really into the pandemic, they put out a statement really naming the persistent racial, ethnic, and socioeconomic inequalities that long preceded the pandemic, but are now in full view. What they said is whose salience has come into sharp view due to the pandemic's uneven impact. And what this does is it provides a spotlight really on the degree to which these inequities exist for people who don't really know the ways in which inequities are produced. So we have this kind of population level understanding of the disparate ways in which the pandemic played out in neighborhoods across the city of Chicago in particular. And the other thing they said is that community-based organizations who are grounded in these communities that are hard hit are going to confront profound obstacles and threats to their programming now and in months to come. So they really recognize that this pandemic is impacting people differentially and the institutions that they rely on disproportionately. And they called upon coordinated action, which is exactly what this is. This is really unprecedented coordination across institutes that we don't collaborate very well. We don't typically do this. And so it's one of the things that this crisis has really called us to do, is to step up, to learn about each other, and to really figure out how do we link arms at this really difficult time. They also called on academic institutions to lead the way. And I think this is something that myself and Linda have been saying for a long time, which is academic institutions can do this much more applied work and be a trusted partner. And our impact would be more significant, would be more impactful. Our influence would be more impactful with academic partners at the table. So this is not work necessarily that an academic institution like us or University of Chicago, who is at the table, would typically do, but I think that this crisis has really called us to this. And the other thing that I just want to call out, our partners use the expression lift up and out a lot. So now I'm going to use this. What I want to lift up is a call to action from an organization called Chicago Beyond, who's an incredible philanthropy organization in Chicago. And what they did really a week after the data was displayed by race and ethnicity across the city of Chicago was overlay COVID cases and deaths with the redlining maps from basically discriminatory housing practices in the 1930s, and really called out that now is the time that we're seeing in full color the ways in which structural disadvantage plays out with disproportionate COVID cases and COVID deaths. And now is a time for us to change our orientation to how we engage and how we do research. So that's just a long way of saying, like, deeply exciting this opportunity is. I'm advancing, right, Emily? Looks like it. Okay, and so what I'm going to talk about is in all the components of this project. One of them falls under what we're doing just around contact tracing. And UIC is called to support the 31 community-based organizations in doing this work. And so our charge is really twofold. It's supporting organizations, and those of you who know community-based organizations in Chicago pretty well, you might have seen from that list, these are not organizations who typically get involved in health work like this. They were identified through that rigorous process, as Emily said, because of the degree to which they're trusted members of the community, and this trust is this key component to successful contact tracing. But having never done contact tracing before, or really probably programming in the health area, one of the things that our call is to support them in being successful, basically, in carrying out SHI tracing. But the other opportunity that we have, and Emily alluded to this, is building a new infrastructure where there wasn't one before. And so this includes not just building up the capacity of community-based organizations who, as William T. Grant Foundation says, will have been profoundly impacted by COVID, but I'm really sorry, I'm going to say this, but it's in my head, building back better. Having this opportunity to really boost the community-based organizations so that they're stronger, as Emily said, that this is community-based capacity building, but also thinking about how are they networked with each other and with us. And so this is an opportunity for the 5 partner organizations to also think about ourselves in this social network of organizations, and how can we connect ourselves to be even stronger. And so we are leveraging the expertise of the partners at the table, supporting the SHI tracing community-based organizations to successfully incorporate contact tracing, and then be responsive to really what we perceive are going to be these fluid and ongoing needs of the contact tracers. Emily discussed contact tracers being hired from the community, never having engaged in this work before. We believe there's going to be an ongoing need for support, and then attending to community-based organizations, community capacity building needs, and then this connection, this networking together. And that really fits into our long-term vision of building this new public health workforce, this new infrastructure. I think that the other thing I just want to say about this potential for building a new workforce and a new infrastructure is this is an opportunity for us to really think about and address sexual violence at the neighborhood level. So really thinking about the ways in which community-based organizations in particular carry this heavy burden of attending to the basic needs of residents in their community, mostly because our structures and our systems don't attend to basic needs in the ways that they might in other countries. That we really live with this great and growing social divide in terms of inequality, income inequality, health inequities, those kinds of things. So we're building this community of practice, and a community of practice is a space in which organizations who share similar missions, in this case it's really conducting the SHI tracing project, come together to learn from each other. And so I think Emily mentioned this, but one of our key visions is that we take a very asset-based approach. We think about what are the assets of the 31 community-based organizations, what are the assets of us as partner organizations, and really build a co-learning model. And this is an opportunity for us to engage in something called praxis. And praxis is real-time action and reflection. It also allows us to think about the ways in which we, as partner organizations or partner institutions, may have contributed to structural violence or systemic racism in the past, and really think about ways to build a structure that would dismantle the mechanisms of systemic racism. We're building this right now, and so I'd like to tell you what it looks like, but it's in development. we launched a needs assessment of our 31 community-based organizations to basically inventory kind of what kind of assets, but also, you know, when you think about coming into this community of practice, into shy tracing, what is it that you think that you need? How can we build your capacity? And what do you have to share also, kind of what is your expertise? So we're working on a model that involves some kind of live training, something not too unlike what we're doing right now, which is bringing our expertise into this space. And then creating these learning networks. So what we imagine with our 31 organizations is that we'd be able to connect organizations that are similar by some dimensions to allow for some peer-to-peer learning. And we think this is also a way for us to leverage the expertise like community organizing, civic participation of the community organizations, and bring an academic lens to this. And then we also imagine that we'll be archiving a lot of learning modules for the organizations who actually just have a lot to do right now, and we'll be able to tap into trainings as they move forward. So when we think about these two goals of making sure the CBOs conduct shy tracing successfully and then expanding their capacity, these are some of the things that we're thinking about. These organizations are onboarding a lot of contact tracers, many of whom have had histories of either unemployment or erratic employment. Think about how can they employ these contact tracers with what we call healthy work principles. So this is really thinking about the contact tracers are actually making a fair wage, but we're trying to make sure that they are what is the word, like funneled into pathways for healthy work. So pathways to other kinds of jobs that contact tracing is the onboarding to. And so this should sound familiar. This is our earn and learn component. And I could say a lot about that, but I know there's some questions, and I'll wrap up so that we can answer some of these questions. We're also trying to attend to contact tracers' mental health issues. This is a job that needs some trauma-informed thinking to go along with it. These will be people engaged in tracing of a disease in their communities without really having done this job before. We also want to leverage the contact tracers' role to really expand the community-based organization's capacity. So our really exciting opportunity that we think we have here as people in the public health system is to have some organizations who have thought of themselves as having a role in a public health system to see themselves. That seems simple, but it's really important. And when we say health in this way, it's really a broad definition of health where we think about health and wellness and the opportunity for everyone to be healthy. We think we have an opportunity to really help with health communications messaging. IO brings a lot of expertise to this in particular, but we're trying to support organizations with messaging these topics that they may not have messaged before. And of course, this is a very complicated time to provide clear communication when there's so much chaos and misinformation out there. And I think I already mentioned asset mapping. In terms of building community-based organization capacity, this is where our Collaboratory for Health Justice gets really excited because we think this is an opportunity for collaboration and coalition building that we haven't had before. We're hoping to get some organizations interested in getting involved in research, either through citizen science or coming on board with us as community scholars. So thinking about leveraging community members who are just experts in their neighborhood, and that's a valuable skill and a valuable addition to research teams. We think we have an opportunity to really ground this in building community resiliency and approaches, really with this structural violence lens. You know, the solution is a healing solution. So what does this look like? This is about power building at the neighborhood level and capacity building. I think I mentioned that last bullet. The other thing that I'm just going to keep calling out IO because she's a really important partner in our shy tracing effort. One of the things she's been doing is really monitoring what other cities have been learning in their community-based contact tracing. We think we're quite unique in centering community-based organizations in our effort, but one of the lessons learned is making sure that you have clear opportunities for communication among your contact tracers and your community-based organizations. And this is because this is new work. None of us have really done this work, particularly at this scale. And so having this opportunity to share what's working, what's not, lessons learned, and really, in some cases, getting out frustrations, and there will be lots of frustrations, and then providing a lot of answers to questions. So we're using Microsoft Teams as a communication mechanism. We think not only will this help with rapid communication and finding answers to problems, but it will build the organization's capacity. If they don't have communication infrastructure like that, they will get that from this grant. In terms of archived modules, I know this might not sound exciting, but this is one thing that we're thinking is a simple thing for academic partners to bring to the table, is to really package some learning and provide some learning to representatives of community-based organizations to advance their capacity to build back their community-based organization. So these are kind of like core tools that community-based organizations need: evaluation, grant writing, systems change. I'm a qualitative researcher. I think everyone needs qualitative research skills. And then civic engagement skills, and that's aligned with really our power mapping and our community capacity building efforts. Our partners are going to bring a lot of fiscal training to the community-based organizations, so what they call fiscal boot camp. This is really important because the way that SHI tracing was structured was to make sure that community-based organizations that might not typically take advantage of this opportunity apply, because we were going to be able to build their capacity as we do SHI tracing. So in the application process, organizations were provided with additional skill building just for the application process. So those smaller community-based organizations that may not have made the cut, we think made the cut into this 31. And so we want to continue to build their capacity. It's one of the reasons why CBOs can really struggle in carrying out their mission. And actually, I wanted to make a point about that. You know, as a community-based participatory researcher, but also someone that thinks about how health and social inequities are part of a social production. One of the things that we know is that community-based organizations are called upon to really do work that's almost impossible. We give them a huge demand in terms of addressing community residents' needs. And so this is a real opportunity for us to think about, you know, how all the partners in this can really build a system that can be more fair and equitable in terms of making it equity in resource distribution, and also kind of listening and learning from each other. So yes. So the last thing is we're actually charged with kind of keeping the community-based organizations centered. I hope you're appreciating the complexity of this effort. It's really quite overwhelming. Every day we are tracking these million different moving parts. And so one of our jobs as the academic partner is to kind of make sure that the community-based organizations always know what's going on. They don't actually need to know the details of the contact tracers themselves. They're the hub that's hiring the contact tracers, but then we're going to spend time with them building their capacity. But we want them to understand exactly what the contact tracers, resource coordinators, supervisors are going through, so that they're aware. And then we also are supporting the community-based organizations in providing earn and learn opportunities for the contact tracers, so that they have this pathway from contact tracers to all these other jobs. And I think that is my last slide. Let me see what Linda's last point is. So, yeah, I think that yes, the city of Chicago was, you know, I would say like uncharacteristically thoughtful about sustainability. This is just a very thoughtful approach. And there's criticism about contact tracing, yes. But what this is actually, you know, attending to issues of contact tracing, but also creating this infrastructure to do what we kind of keep saying, kind of contact tracing plus. And the contact tracers actually might spend a lot more time on this plus, and that's a good thing. Like that would be the best case scenario if the tracing need is low and we can actually really think about this as an economic development effort that is made possible because of contact tracing, but actually becomes economic development. Maybe just one more thing I'll say about that. The important thing for me is this isn't just about getting people to jobs. And if you think about the kind of job opportunities that might be available to the contact tracer, there are these kind of traditional healthcare jobs. So you might be a contact tracer now, but with some earn and learn opportunities where we train you for other jobs. You might be a home healthcare worker or a nurse's aide, or you might work in a hospital system kind of in finance. So that's one kind of pathway and maybe the most traditional. But there's also these exciting pathways from contact tracer to community health worker to other kinds of jobs in the public health system that maybe don't even exist. So someone is calling me over and over again, which is so annoying. Let's see if I can turn it off. These jobs in the local public health system that maybe don't exist right now, but we would make possible, and in doing so, we're really transforming our local public health system in this really exciting way. And I'm going to mute myself because someone needs to get a hold of me urgently. So I'll turn it back over to you, Emily.
Thank you. And I just wanted to reiterate that I love working with Jenny because every time she explains it, she really helps you to see this vision of pulling the communities into the work that we do. So the community is not just someone or an entity to be acted on, but an entity to be acted with. And so just this idea of having the communities participate in this, what's really exciting for us too is that we've started doing a needs assessment of the 31 community-based organizations, and we've seen that they have a lot to offer as well. They have a lot of expertise in terms of grant writing and building trust in their communities. They know their communities really well. So I think, Sinan, to your point, how do you increase participation? How do you build trust? One of the reasons that I think the city of Chicago was trying to leverage the community-based organizations was for that very reason. If we're able to partner with community-based organizations who know their constituents and their members, that might be a way of helping to build trust so that people feel comfortable. Hey, I know that organization, they do a lot for our community, and hopefully that translates into trust for workers being employed, word of mouth from the contact tracers who are hired to other people that they might know, and then just, overall, just the fact that this initiative is there. So so it's very exciting. And, one of the jobs that Jenny was sort of referring to was, or sort of an emerging role, is even the idea of a care team coordinator in primary care settings. So you might have someone who's from the community who sits in an appointment with the primary care physician and the patient, who can sort of act to translate, and not just literally translate if someone speaks a different language, but also to translate, some of what the physician does, or, if they're with the provider all day long, they get to hear little bits and pieces of what the provider does and why they do that. But they also get to speak the language of the community member and to say, wow, I know what challenges you're going through. The primary care physician said to do these kind of exercises, but it's hard for you to find time. Let's brainstorm together different ways that we could sort of help you find time to exercise, or help you find ways of eating more healthfully, given that food's expensive, time is short. And so, it's a really exciting opportunity just to think about what could the future look like if we have this opportunity to build a really strong infrastructure. So I appreciate you listening to this. Hopefully there's been some interesting information, but Jenny and I are happy to answer questions. I'll be around to answer questions. Perfect. So any questions that you might have, I think we answered one, and then there was the question about, are we doing contact tracing for homeless individuals? And Linda answered that one, I think, but one of the thoughts is that, if someone is homeless but they still have access to a phone or have access to a phone number, the contact tracer will try to reach out to that person. But if they don't have access to the phone, it's going to be really hard for them to get in touch. So there are some other initiatives that are going on, but and some other initiatives that UIC is helping with in terms of street outreach and things like that, that could also be connected here. And so that might also help to address some of these issues.
Thank you, Emily, and thank you, Jenny, for the insightful discussion. Thank you for helping us to see a clear picture of what shy tracing looks like. Last week, like I said, we had someone from the state talk about shy tracing in the state, but then he kept referring to the fact that different cities have different ways of conducting theirs. So I think you really helped us to see how Chicago has been conducting theirs. So thank you. There's a question here for you. Someone said, after shy tracing ends, will there still be some sort of anchor organization to maintain these new CBO partnerships?
I think that's a great question, Megan. This is Jenny. I'm back. Sorry. That's exactly what we're thinking. It may be not an anchor organization, but an anchor collaboration that, that we would connect and network these organizations so that we have kind of a new infrastructure in place. And one of the exciting opportunities we think we have here is many of us have been involved in the city health department, the Chicago Department of Public Health's planning processes for developing Healthy Chicago 2020, and I hope you all know about that, 2025. But we often need more community input in developing the plan for health for the city of Chicago. We think we're creating like a infrastructure that can be in position to provide that kind of strategic information to the city for their planning processes. So that's just kind of one example of a new collaboration that we hope we will leave in place after shy tracing.
Thank you. There's another question here about apps, developing apps. Last week we learned that IDPH has no interest in doing the exposure app. Does CDPH or shy tracing have any interest or intent in developing mobile apps for exposure?
So this is Emily. I just wanted to mention, it was actually funny. I was talking with a friend of mine last night who's a computer science professor who deals with privacy. And he was basically saying there's no way a contact tracing initiative can help unless you start using, some of these technological innovations, either apps or, there's some sophisticated things where if you have tracking software on your phone, it won't necessarily tell you when you came into contact with someone, but if your sensor was within a certain distance of another person's sensor and that person tested positive, it will, it can send you messages automatically saying, hey, you may want to go get tested. As far as we know, we have not personally heard anything. I have not personally heard anything from CDPH or the Shy Tracing Initiative about this kind of app or technology. So I don't think that they're at that stage yet. And I think, one of their big concerns too is that there are a lot of privacy implications and security implications. If someone has this software on the phone and they're tracking you and you turn up positive or you've been in contact with someone who's positive, I think that there are some people who might shy away from that. And the fact that there's sort of a lack of trust, broadly speaking, something like that might sort of not be as palatable to people. So I think for now, CDPH has expressed an interest in expanding their contact tracing core. I don't want to say that they won't necessarily consider apps in the future, but just from our perspective, and at least from what I've been hearing, that hasn't really come up in conversations. Jenny or Linda, do you have other information?
I don't, Emily. CDPH does have an app for finding a testing site and deciding whether you should get testing, but I haven't heard of expanding an app for contact tracing.
Thank you. So I have this question. Given that the incidence rate seemed to be dropping, do you think that the contact tracer supply will be greater than the demand? Last week, we had someone from the state who talked about how there are times in a week, like you really don't have contacts assigned to contact tracers. And then some other weeks you just have very high numbers. Maybe some things happen. So do you think the supply of contact tracers will be greater than the demand? And since it's a hardly paid job, like if they don't have things to do, how will that affect, them getting paid? Or do you have substitute programs such that even if they are not contacting people, there are other things they can be doing?
Ooh, could I take this one first, Jenny, and then I'll let you chime
Please,
in.
no.
This is one of the exciting pieces, because this is a reason that contact tracing has failed in some other cities, is that the demand was just not enough for the number of contact tracers. And so what ended up happening is the municipality that hired contact tracers had to let them go. And that's one of the worst things that you could do. You promise people these occupations, you start hiring from communities that have historically not had access to economic opportunities. You hire them on, and then you say, oh, demand's not high enough, we're going to let you go, and the program's not over. So the thing that I really appreciate about the city of Chicago is, again, they're looking at this as an infrastructure. And so their idea is that if demand is low, that's actually really exciting, because that's capacity. So for the community-based organizations, because they've hired on this workforce, if the contact tracers aren't engaged in contact tracing, that means that maybe there's an opportunity for them to engage in programs that are part of the community-based organization, in leadership opportunities, in additional professional development. There are all these other opportunities that exist for the contact tracers when there's downtime. And so I think one of the things that we're hoping to do with the communities of practice is to try to help the community-based organizations to find opportunities that are, productive for both sides. One of the things that Chicago has explicitly said is that if demand is low, they don't want a contact tracer sitting in a back office making photocopies, or something that's productive for the CBO, but not really developing the contact tracer skills. They want these extra activities to be professionally developmental and skill building and things like that. So one thought is, how can we help the community-based organizations to build these activities that allow the contact tracers to, develop their skills on the job in a community-based organization that's really reaching out on the ground, helping communities. And so that's actually kind of exciting. So the city of Chicago has sort of promised these funds. They have access to them, and they've said that if demand is low, the community or the contact tracers are still going to be hired for the contact tracing work that is there, but there will also be these opportunities potentially to use that capacity to invest back into the communities. So sorry to, I know, Jenny, that's probably really exciting for you too, but that's
No, I know, I do think it's a marriage of a lot of our shared interests. But I do think, and I do think that I would just echo everything else that you just said. One of the things that's exciting about this is it is a school of public health, University of Chicago, Sinai Urban Institute, a community college, in a marriage with the Chicago Cook Workforce Partnership, which is an organization that really thinks about workforce readiness and pathways to work, and just even our initial conversations about how we think about this also differently is indicative of, I think, this creativeness that can come from partners who don't typically talk to each other. So, for example, the Chicago Workforce Partnership is building in these professional development opportunities for people to help them on their pathways to work. And while they're really important, they're missing a lot of components that we think about when we think about work as a social determinant of health. So like Suhi, Sinai Urban Health Institute, is bringing this layer of soft skills. So it's not just how to be professional, put together a resume, show up for an interview. It's these soft skills of cultural humility and being trauma informed and dealing with conflict resolution. And then I think our School of Public Health brings this layer of thinking about the ways in which work impacts our health and what are job situations and job titles that allow for a more healthy life. And so I said this before, but there's this opportunity to kind of create pathways for people that maybe weren't there before. And so the contact tracer could become a community health worker, could end up applying to our School of Public Health, and doing something that maybe wasn't possible without this kind of effort in place.
Thank you for answering the questions. I would like to say, from my own end, I would like to say thank you to Jenny and Emily and Dr. Foss for putting this together. I feel like if all these plans work well, there'll be a significant impact of this on health disparity, even in Chicago. Thank you for taking the time to brainstorm and working with your team to make this happen. So I'll hand over to Dr. Foss now for final thoughts.
I want to thank Dr. Stiehl and Dr. Hebert-Beirne, Jenny and Emily for such a great presentation. Every time I hear about it and think about it, even though I'm very involved with it, I learn a lot of new things, and it excites me even more as I'm watching it unfold and develop. So all of you guys, will have the opportunity to see how this pans out in our city and maybe compare it to, stuff that you're hearing about contact tracing efforts in other places. But anyway, this is a great presentation. Thank you so much.
Thank you so much for having us. I echo everyone's thoughts that this is really exciting, and I think, as Linda and Io said, assuming that all the great thoughts that we keep having actually come to fruition, it has the potential to be this amazing project. And so, we're very thankful to be a part of it, and we're so excited because it's now sort of ramping up and up and running. And so all these things that were just plans before are starting to come to fruition. So fingers crossed for the rest of it. And thank you so much for letting us come and talk to you about it.
Bye,
Thank you.
everybody. Have a good week.